we look at two criteria, and I came across this criteria when I was reading about the adult-Still's disease. Okay, adult-Still's disease. So this is what is known as the Yamaguchi criteria and the Fautrel's criteria. So first of all, what is a criteria? A criteria is just something that I list. So if I check a patient and I'm able to see this thing, I'll now confirm that, oh, this patient has this issue. Do you understand? So we have the Yamaguchi criteria, and then we also have the Fautrel's criteria. Let's quickly look at what they are. So let me have it. So we'll discuss them one by one, but just so you know that the two of them, they are diagnostic guidelines for confirming adult-onset Still's disease. So when you talk about the Yamaguchi, what are the things you see in the Yamaguchi criteria? So requirements is if you are able to see 5 or more of these criteria with at least 2 major. So the criteria are divided into the major and the minor. This is a major, this is a minor. So for the major, the person's body temperature is more than 39 degrees Celsius. He's having a lot of pain in the joints and a lot of inflammations in the joints, and this has lasted more than 2 weeks. Then the person is having a lot of rashes. See these rashes? They call them the salmon pink rashes. Then leukocytosis. If you do a blood test, the white blood cells are actually shooting up. So at least if you're able to see 2 of these major, it confirms it. Okay, and the minor criteria include sore throat, lymphadenopathy, that is enlargement of the lymph nodes, or splenomegaly, that's enlargement of the spleen. Then hepatomegaly, which is enlargement of the liver or abnormal liver function test. Then negative ANA, all those markers for inflammation and rheumatoid factor. Okay. Then when you talk about the Fautrel's criteria, okay, so this one, for you to make a diagnosis, you need about 4 major criteria, or if you're able to see 3 major criteria and 2 minor criteria together. So what are the major criteria and what are the minor criteria? So the body temperatures, that's for major, is more than 39 degrees Celsius. There's a lot of pain in the joints. Transient erythema. Okay. Then that means you're having inflammations on the skin, it's coming and it's going. The Pharyngitis, so there's inflammation of the pharynx. The Neutrophils is getting up more than 80%. Glycosylated ferritin. Then for minor, Maculopapular rash. Then also if you do a blood test, the white blood cells are shooting up more than 100,000 millimeter cube.